There is some new insight this morning into the impact of HIV treatment right here in Georgia. Researchers at Emory say decades of medical progress have fundamentally changed the trajectory of the disease, turning what was once a deadly diagnosis into a manageable condition for many people. Let's look at this study in person with the person behind it, Professor Patrick Sullivan with Emory's Department of Epidemiology. Glad to have you on this morning. So first off, let's start with the big question. What's still the biggest misconception about HIV today?
I think some people who may have been familiar with the epidemic in earlier years may not know that we now have treatments that are available that essentially mean people living with HIV are living with a manageable condition and can lead long, healthy lives. And one of the things we wanted to do in this analysis was try to quantify just all the benefits that have occurred because we have these improved treatments that are now available to people.
And it includes, of course, the antiretroviral drugs. So for people who may not be familiar, let's talk about those drugs and how they treat HIV and also prevent it from spreading.
Sure. In the human body, when the HIV virus is introduced, it will replicate. It will use the body's resources to replicate, make more copies of itself. And those copies essentially can be spread through sexual contact or through blood. Antiretroviral treatments just essentially shut down that factory of new viruses. So the virus may still be tucked away in some places in the body, capable of coming back, but while those antiretrovirals are in the body, the virus simply can't replicate and therefore can't be passed on to other people.
And it's saving a lot of lives in the process. Let's talk about the study that your team is behind. What data specifically were you analyzing?
We were analyzing data that looked at two sides of a cost equation. One is how much have we spent on treating medications to treat people living with HIV? And the other side of the equation was what have the benefits been from that investment in treatment? And what we found was that over the period of time in Georgia, that about $36 billion have been spent on treatments for people living with HIV, but the economic benefits of that totaled about $107 billion. And those benefits include things like people being healthy and being able to stay in the workforce. They include things like people living with HIV not progressing to that worse state of health that requires more medical treatment, but just maintaining their health with antiretrovirals. And it also includes things like people staying in the workforce and working, paying taxes that come into the government. So all those benefits of keeping people healthy really far outweighed the cost of treating people for HIV infection.
Yeah, and we're seeing a lot of progress, the progress that you mentioned, but your study also warns that some of that could stall. What risks are you most concerned about happening right now?
You know, we really have developed in Georgia an important system to support people who might be at risk for HIV, people who are living with HIV, and that is a multi-sectoral response, which is critical. It means community-based organizations, it means treatment facilities, it means reimbursements for treatment and care. And I'm concerned that if we undermine this really community, broad base of community involvement in HIV prevention and care, these are organizations that may be supported through grants by CDC, that may be supported by other public funds, that we lose part of that infrastructure that makes HIV prevention and care in Georgia work. So I think we really have to pay attention to the investment in our community partners and those aspects of healthcare, supporting healthcare institutions and reimbursement that make Georgia and Atlanta in particular a place that is responding in a vigorous and an effective way to the HIV epidemic.
All right, Professor Sullivan, thank you so much for joining us this morning. We appreciate you sharing that with us.
Thank you.